Hi everyone, I am Dr. Krishna Reddy Taduri, consultant endocrinologist, Medicover Hospitals, Madhapur. Today I would like to discuss regarding one of the important problems in facing by the pregnant women, that is gestational diabetes mellitus. So alarmingly the gestational diabetes mellitus incidence is increasing. So we are almost seeing up to 10 to 15% of the all pregnant women, they are facing this problem. So this is due to the age of marriage and the age of pregnancy is as in increasing, and the family history of diabetes, and overall the obesity has been increasing and increasing the incidence of PCOD. So all these are contributing into the increased incidence of the gestational diabetes mellitus. So the causes being the excessive weight gain, especially during the adolescent period, and PCOD history, and having a previous history of pregnancy with gestational diabetes, and the previous history of large baby deliveries. So, and the ethnicity, the Asians, we are more prone for the gestational diabetes and comparing with the Western populations, because even though our weights is less, we are having excessive amount of fat with the equal height and weight in comparison with the Western population. This is called sarcopenic obesity, and which is the majority of fat is majorly depositing around the abdomen and in the visceral fat compartments. So to tackle this gestational diabetes, whenever if you have a strong family history and you are having obesity, tackling this issue should start as early as in the childhood. So don't give your child any junk foods like packet fruits, chocolates or cool drinks or any ice creams which contain the very empty calories, only calories without any major nutrition. So they should have a proper dietary counseling and proper dietary education in the schools itself and from childhood itself. So whenever during the pubertal years and during the developmental ages, so they should also not only on education, they should also focus on the lifestyle, like they should engage in the sports activities, they should maintain their lean body mass, and they should avoid the obesity. And once they should, with a proper lifestyle, they can avoid this gestational diabetes. And if you are a gestational diabetes, which usually occurs after 20 weeks of gestation, because a lot of anti-insulin hormones have been produced from the placenta after 5th month of gestation, which will lead to the relative insufficiency of the insulin in the mother. So this is also called a stress test for the future diabetes. If you have a gestational diabetes, the risk of having a type 2 diabetes in the future is almost 50%. So you should be able to avoid this type of gestational diabetes. And even if you're a gestational diabetes, with a proper diet and exercise, you can avoid the future onset of the type 2 diabetes. So we majorly 80% of the women with gestational diabetes can be managed with the diet and exercise alone. If there is no contraindication to your exercise as addressed by your gynecologist, you should take a proper exercise, and in the form of either walking or any other yoga or anything you can take in the pot. And diet is very, very important. You should not eat less, you should not eat more. So based on your BMI levels, pre-pregnancy BMI levels, we may give target of weight gain during the gestational age. If you are an overweight or obese woman, especially morbid obese, BMI of more than 32 before pregnancy, we'll advise not to gain weight more than 5 to 9 kgs. So you should be very cautious in picking up your diets, which should contain adequate amount of carbohydrate. It should not be less than 170 grams of carbohydrate, and good amount of protein and less amount of fat should be there. To minimum of 1600 kilocalorie diet, we will usually subscribe to the women with the gestational diabetes to prevent any fetal abnormalities. And these two are very important, exercise and diet. So apart from, if you are not able to achieve your glucose levels, so we may prescribe some medications like metformin, or some of the patients require insulin injections also to control their hyperglycemia during pregnancy. So that control of glycemia is very, very important, because the hyperglycemia will lead to a lot of problems to the baby and as well as the mother. So we are seeing a lot of in utero deaths of the babies if you don't have a good control of diabetes, and they are more prone for the preterm deliveries, and post delivery also the babies will face the problem of hypoglycemia, large baby, which results in the injuries to the baby during delivery. And also there is the lung development of the babies is also not good, especially if you are a type 2 diabetes which are going for the pregnancy. You should be very cautious, because during the early part of gestation, if you have a hyperglycemia, there is a risk for the babies to have a malformations. So you should try to have a very strict control in pregnancy with the help of your treating endocrinologist.